If you want awesome products at great prices, check out the description. A leading public servant has issued a stark warning to the Australian Labor government: less reviewing, more doing. The call comes from Blair Comley, Secretary of the Department of Health, Disability and Ageing, a figure widely respected within the Australian public service, whose advice to Health Minister Mark Butler has been revealed through Freedom of Information documents obtained by Guardian Australia. Comley's message is simple, yet profound: the sheer volume of government reviews commissioned during Labor's first term risks overwhelming the bureaucracy and inflating public expectations beyond realistic delivery. Over 70 reviews as commissioned, consulted upon, or published within Labor's first 3 years in office represent a significant investment of time and resources. Comley's internal briefing highlights the substantial financial cost, estimating that each review can exceed $25 million, a figure that drains departmental resources and adds to an already demanding workload. He argues that the government possesses a wealth of existing data from completed reviews, already containing extensive recommendations and informed by broad consultation. This, he suggests, provides a solid foundation for action, rather than further analysis. Comley's proposed shift in approach, more doing, less reviewing, directly addresses the escalating expectations associated with each new review. He points out the inherent expectation that governments will adopt all recommendations, a challenge amplified by the sheer volume of suggestions generated. This is exemplified by the Health Technology Assessment Review alone, which yielded 50 recommendations for reform, many entailing significant implementation costs. Other major reviews cited include the Medicare Review, the Private Hospitals Financial Health Check, and the National Disability Insurance Scheme Review. Comley's perspective is informed by decades of experience at the highest levels of Australian government. His career includes leadership roles within the Department of Climate Change, before his dismissal under Tony Abbott, and the New South Wales Premier's Department, as well as experience in the private sector as a consultant. His appointment to lead the Department of Health in 2023, following the May 2023 election, underscores his stature and expertise. Speculation even placed him as a potential candidate to head Anthony Albanese's Department of the Prime Minister and Cabinet, a position ultimately filled by Stephen Kennedy. His advice to Minister Butler highlights the potential trade-offs. Implementing the findings from numerous reviews might require reallocating funds from other Labor election commitments, including crucial areas such as Medicare reform, lowering medicine prices, addressing workforce challenges, and improving mental health and Indigenous health care. These considerations are particularly pertinent given the current tight fiscal environment, with health spending already placing significant pressure on the federal budget. Comley's briefing also acknowledges the department's commitment to fiscal discipline and cost minimization, despite facing anticipated reductions in internal resourcing, a projected 6% to 10% decrease from July 1, with further reductions expected in 2026 to 27. While significant productivity gains are reported in areas like cancer treatment, improvements in patient quality of life have lagged behind. He emphasizes that the work of the first term has established a strong base of information and a clear mandate for reform, signifying the need to prioritize action over continued analysis. While he acknowledges the potential for future reviews, he stresses the need for a high threshold before commissioning further inquiries, only when compelling evidence warrants it. The briefing, delivered to Minister Butler on May 13, has prompted no immediate public response from his office. The ongoing debate surrounding the balance between rigorous review and decisive action highlights the significant challenges faced by the government in navigating competing demands within a constrained fiscal environment, a balancing act that will shape the government's policy agenda in the years to come. The implications extend beyond the health portfolio, touching upon the overall effectiveness and efficiency of government operations across numerous sectors. This call for a more streamlined, action-oriented approach serves as a powerful reminder of the critical need for efficient resource allocation and the effective translation of policy into tangible outcomes for the Australian people. The coming months will be crucial in determining how the government responds to this critical advice and whether the balance between review and action can be effectively struck. The nation watches closely.